As we approach 2 years since the first case of COVID-19 was detected in our state, Colorado reported only 52 new cases of COVID Friday. That's the lowest count since our state started tracking. This graph is also a clear indicator of where our state is. The positivity rate has dropped below that 5% goal, a stark difference from that massive spike in January and February. And as Colorado appears to be heading out of the most intense versions of the pandemic, our state's top medical officials say these 2 years have prepared them to whatever may shape the pandemic and what's to come next. Connor McHugh joins us live in studio tonight on this 2-year mark. And Connor, the state and our medical professionals have come a long way.
Yeah, Tori, in the past 2 years in Colorado, we've seen more than 1.3 million COVID cases and 12,000 deaths, more than 12,000 deaths. But we've also seen the state improve its response and introduce an effective vaccine. Experts say now we're in a good place to manage this pandemic as well as many others in the future.
It's a great understatement to say that it's been a long 2 years.
From shutdowns and variants to a historic vaccine, the COVID-19 pandemic has been an unprecedented experience. Now, 2 years later, there's hope for normalcy.
We're at a point now where we have a large level of immunity.
Since Colorado's first case, Scott Bookman has been among those calling the shots. While testing and surveillance were major challenges early on, he says the state now has a solid framework.
We have the ability to do more than 50,000 tests per day.
The trick moving forward will be scaling that and other systems up and down, says Dr. Lisa Miller with the Colorado School of Public Health.
We've made huge advances as far as therapy and treatment for COVID-19, vaccines for COVID-19, the way we monitor it. We can hope that we don't have a future wave or a future surge, but I think we definitely need to plan for a future wave or a future surge.
Bookman says it's all part of the state's roadmap moving forward, a plan that includes strengthening the healthcare workforce, improving hospital readiness and surge planning, and investing in the health system. As cases decline and life feels a bit more normal, there's no better time to prepare.
Now, the majority of Coloradans have the opportunity to go forward and know that we will be working behind the scenes to prepare for whatever may come.
After 2 years of this, these experts acknowledge there are also things that can be improved. Those include replenishing the workforce in healthcare and getting more people, especially those in marginalized communities, vaccinated. Tori?
Thank you, Connor.